A patient is crashing. A patient is crashing. Chaos in the room. Do you know what to check first? In the high-stakes world of healthcare, those initial moments can determine an entire outcome. When a patient's condition suddenly deteriorates, chaos can feel like it's taking over. Your heart pounds, your mind races. But what separates a good clinician from a great one is the ability to cut through that noise with a clear, systematic approach. This is where the ABCDE assessment becomes your most trusted tool. Simple, repeatable, powerful, a framework to identify and manage life-threatening problems in a logical order. For an adult nursing student, mastering this isn't just about passing an exam, it's about building the fundamental bedrock of your entire clinical practice. The ABCDE assessment is the universal language of emergency care. In a high-pressure OSCE, on a busy hospital ward during your placement, or as a registered nurse leading a team. This method will be your constant companion. It gives you a structure to rely on when faced with uncertainty, and most importantly, to stabilize your patient. This isn't just a checklist to memorize, it's a life-saving habit to internalize. Think of it as building a house. You would never start with the roof before you have laid a solid foundation. Similarly, you cannot effectively manage a patient's circulation if their airway is blocked. Airway. Secure the airway first. Breathing. Ensure breathing is adequate. Circulation. Then address circulation. This logical progression is its genius. It prevents you from getting distracted by dramatic but less immediate problems, like a leg injury, when the patient is silently struggling to breathe. It helps you organize your thoughts and actions under immense pressure, making sure nothing vital is overlooked during those first critical minutes of an emergency. Therefore, we are going to break down this essential skill piece by piece. A, B, C, D, E will show you what signs to watch for, which red flags demand instant escalation, and how to avoid common pitfalls students make in their OSCEs. This isn't about complex medical jargon. It's about clear, practical knowledge you can use now. By the end of this, you'll understand the what and why behind ABCDE. You'll feel more prepared to apply it confidently when it matters most, because this is a skill that truly saves lives. The first and most critical letter in our assessment is AA, which stands for airway. Before anything else, you must determine if the patient has a clear and open airway. Life-sustaining oxygen cannot reach the lungs if the path is blocked. The question you need to answer immediately is the airway patent? A simple way to check this is to ask the patient a question, such as, "Can you tell me your name?" If they can speak back to you in a normal tone of voice, you can be reasonably confident their airway is clear. This is a quick, yet remarkably effective initial assessment. However, if the patient cannot speak, or if you hear abnormal sounds, you must investigate further. Listen for gurgling. Gurgling may indicate saliva. Gurgling may indicate vomit. Gurgling may indicate blood. Listen for stridor, a high-pitched, harsh sound suggesting upper airway obstruction. Visually inspect the patient's mouth and throat if it's safe to do so. A compromised airway is an immediate, life-threatening emergency. You have only minutes, sometimes seconds, to act before irreversible brain damage can occur. If you identify an airway problem, your action must be immediate. If it's just the tongue falling back in an unconscious patient, perform a head tilt, chin lift. If there's a suspected neck or spinal injury, use the jaw thrust maneuver instead. If there is fluid or vomit, you may need to use suction to clear it. In an OSCE setting, you must verbalize these actions clearly. The patient is making a gurgling sound. I'm concerned the airway is compromised. I will now perform a head tilt, chin lift, and use suction to clear the airway. A is for airway, the absolute priority. A helpful memory tip: air goes in and out. In your exams, the examiner expects you to rapidly assess patency and verbalize immediate corrective actions. Don't move on to B for breathing until you're confident the airway is secured. This first step sets the stage for everything that follows. Getting it right is non-negotiable in patient safety. Once you have secured the airway, you immediately move to B for breathing. An open airway is useless if the patient isn't breathing effectively. Start by looking at the chest. Is it rising and falling symmetrically? Is the patient using extra muscles in their neck and shoulders to breathe? This is accessory muscle use, a sign of respiratory distress. Count the respiratory rate for a full minute. Too fast, tachypnoea is a red flag. Too slow, bradypnoea is a red flag. Simultaneously, check oxygen saturation with a pulse oximeter. This small device gives a vital number showing blood oxygen transport. Immediate action for breathing problems: provide oxygen. If saturation is low, typically 94% on room air, give supplemental oxygen via mask or nasal cannula. Verbalize in the OSCE. The patient's respiratory rate is 28, and their oxygen saturation is 89%. This is a red flag. I am applying high-flow oxygen and will call for senior help immediately. Listen to the chest for equal air entry and for abnormal sounds. Wheezing crackles. This is about the heart, blood vessels and blood volume. Check how well blood is perfusing vital organs. Begin by checking the pulse. Fast, tachycardia; slow, bradycardia; strong and regular, good; weak and thready, concerning. A weak fast pulse suggests shock. Assess the skin. Colour. Are they pale or cyanotic? Feel hands and feet. Are they cold and clammy? These suggest peripheral vasoconstriction to protect core organs. Key measurements: blood pressure and heart rate. Low BP with high HR warns of shock. Look for external bleeding. If present, apply direct pressure immediately. If low BP without bleeding, prepare IV access for fluids. As a student, recognize and escalate urgently. In an OSCE, say, pulse 120 and thready, BP 85/50. I am concerned about circulatory collapse. I will call for immediate help, apply pressure to any bleeding, and prepare for IV access. After addressing the immediate life threats of airway breathing circulation, you move to D for disability. This step is not about long-term disability, but rather a rapid assessment of the patient's neurological function, which gives you a snapshot of their brain's status. A sudden change in consciousness can indicate serious problems like a stroke, low blood sugar, a drug overdose or hypoxia, a lack of oxygen to the brain. The simplest and most widely used tool for this is the AVPU scale. A, alert; V, responds to your voice. P, responds only to a painful stimulus like a gentle pinch. U, is completely unresponsive. A more detailed assessment involves the Glasgow Coma Scale, but a quick AVPU check is often sufficient for your initial ABCDE. In addition to their level of consciousness, you should check their pupils. Are they equal in size and reactive to light? A unilaterally dilated, a blown pupil can be a sign of a neurological emergency. You should also quickly check the patient's blood glucose level. Very low, hyperglycemia. Very high, hyperglycemia. If you find any new confusion, drowsiness, or unresponsiveness, your action is clear. Escalate immediately. Finally, we arrive at E for exposure. This step is often overlooked in the heat of the moment, but it is crucial for a complete assessment. You must adequately expose the patient to look for any signs you might have otherwise missed. This means systematically removing their clothing to check their entire body, head to toe, front back. You are looking for hidden bleeding, rashes, sepsis or allergic reaction, injuries, wound, swollen red calf, DVT. A patient might not be able to tell you about a wound on their back, so you have to look for it. While exposing the patient, two principles are paramount: dignity, warmth. You should only expose what is necessary for assessment and cover them back up as soon as you are finished to maintain their privacy and respect. Critically ill patients lose body heat very quickly, which can worsen their condition. Therefore, you must keep them warm with blankets. I am now moving to exposure. I will respectfully remove the patient's clothing to perform a head-to-toe examination for any hidden injuries or rashes, while ensuring I maintain their dignity and keep them warm with a blanket to prevent hypothermia. This demonstrates a holistic and patient-centered approach. Knowing the steps of ABCDE is one thing, performing them smoothly under pressure is another. Success in your OSCEs and on your placements hinges on your ability to translate this knowledge into confident action. Examiners are not just looking for you to recite the letters. They want to see you think and act like a nurse. This means speaking your thoughts aloud, articulating your findings, stating your intended actions clearly. For instance, instead of just putting a pulse oximeter on, say, I am applying a pulse oximeter to assess the patient's oxygen saturation. One of the most common mistakes students make in OSCEs is rushing through the steps. Or even worse, panicking and forgetting to escalate. Obstructed airway, a critical red flag. Oxygen saturation below 92%, a critical red flag. Systolic blood pressure below 90, a critical red flag. These findings demand immediate escalation. In your exam, explicitly state, this is a red flag. I am pressing the emergency bell and requesting immediate assistance from the medical team. Forgetting to call for help is a critical failure. To fix this, practice slowing down. Say each letter out loud to pace yourself and ensure you don't miss a step. Practice with blood pressure cuffs. Practice with oxygen masks until you can use them without fumbling. On your clinical placements, make ABCDE second nature. Ask your supervising nurse if you can perform a supervised ABCDE assessment on stable patients. Watch experienced nurses respond to emergencies and observe how they move through the steps. Familiarize yourself with the ward layout. Know where the emergency trolley is kept. Know where the suction equipment is kept. This preparation turns panic into purposeful action. Remember, calm and clear communication with the team is as important as clinical tasks. The ABCDE approach is your safety net, grounded in robust evidence and recommended by bodies like Resuscitation Council UK. It provides a standardized method so clinicians speak the same language in an emergency. It is fast. It is effective. It gives you control in a chaotic situation. Practice it relentlessly. Be confident in your assessment. Never hesitate to call for help when you spot a red flag. If you want a full OSCE walkthrough video, comment ABCDE below and subscribe. We'll link this to evidence-based practice, national guidelines, and clinical reasoning, so your answers sound confident and professional. If you're an adult nursing student, the ABCDE assessment is non-negotiable. It's tested in OSCEs, exams, and placements, and mistakes can cost marks and safety. If you want to pass adult nursing, OSCEs, and feel confident on placement, subscribe to Mental Health Scholars Hub and comment ABCDE if you want a full OSCE walkthrough next. This saves lives.